everyone, welcome to our webinar event. Thank you so much for joining us today. How are you all? Healthy, right? And how about your mental? Well, I hope so, because you're better. Let me introduce myself. I'm Sundari from SMA Swasta Samanhudi as the host of this webinar. Before the presenter actually starts, let us hear opening remarks from our three instructors, namely Sir Chandra, Ms. Diana, and Sir Satya.
Okay, good afternoon everyone. Today is the third seminar that has been held by this group that consists of three persons, which is Cecilia, will be leaders from the SMA Maitreyawira this webinar, and also the thanks to all participants. Okay, also this answer, also thanks to certain initiatives that really help us in this wonderful webinars. Okay, and then one participant for the webinars. Okay, and then I also want to say that if for every participant has questions to ask about their webinars, talk about the mental awareness hub, don't hesitate to ask them. Okay, you will get a very wonderful answer because this group are very fabulous. Okay, without wasting any time, I will give back the show to Sundari. Thank you.
Thank you to the moderator for all the opening remarks. Well, that's right. We will raise the topic of mental health awareness. Why do we bring up the topic? Because in this pandemic, many people are so focused on taking care of their physical health that they are indirectly ignore their mental health. In fact, both are interdependent, so they must be balanced. Well, that's the material that will be presented by our presenter. So without any further ado, I will turn the time over to
Thanks to Sundari for hosting our webinar today. So in this webinar, we will talk about mental health awareness, which will be presented by Cicillia Huang from SMA Swasta Samanhudi. She has a lot of achievements as well, such as Champion of English Speech 2019, Top 10 Finalist English Olympic 2018. So without further ado, I'll give this to the presenter, which will be talking about mental health awareness. Are you ready, Cecilia? Cecilia?
Okay.
So we are gonna wait for her to share her screen.
Okay, so let's just get started. Hello everyone, thanks for joining today's webinar. So today I'll discuss the material on mental health awareness. I'm not just going to explain what the definition of the mental health or why we should be aware of our mental health, but I'll also include the various types of the mental health, like the symptoms, the treatment, and also the prevention of the mental health. So without any further ado, let's just get started. So the first one, what is mental health? Mental health is a level of psychological well-being that can affect your thoughts, feelings, and behavior. Mental health consists of several types of conditions that are broadly categorized as healthy conditions, anxiety disorders, stress, and depression. Well, I can say that if there's such a thing as physical health, then there must also be a mental health. Well, if physical health is easier to detect than mental health, like a healthy body, it will not look too bad or not too thin, like it will look so fit, of course. While an unhealthy body will look too fat or too thin, weak, and powerless. And mental health, on the other hand, can only be detected by the change on the person's behavior, thought patterns, feelings, and the way they socialize or relate to each other. Then, if there's such a thing as mental health, is there also such a thing as mental illness? So, mental illness is a health challenge that can affect the way we think about ourselves, relate to others, and interact with the world around us. They affect our thoughts, feelings, and behavior. Mental illness can disrupt a person's life or create challenge, but with the right support, a person can get back on a path to sustainability and wellness. So, you could say that mental illness is where our mental health has decreased performance and function. Therefore, in the next section, I'll discuss the material about mental illness further. So, why is it important? Okay, so why is this topic so important that I brought up this topic as the topic of today's webinar? So, I'm not bringing up this material because I'm good at the material or like I accidentally read an article about this material on the internet and thought like, wow, this topic is so amazing. I'm covering this. Well, it's not like that. It's more like, because in my opinion, there are still a lot of people in the world who lack of mental health awareness. So, there are still so many people who are not aware of their own mental health. Most people only care about their physical health, like when they're coughing, they'll buy the cough medicine. When they have an eye pain, they'll look for an ophthalmologist. When they're not feeling well, they sit on the internet, whether their symptoms refer to the COVID-19 virus. Well, okay, in my opinion, maintaining a healthy body is very, very important because without a healthy body, it will become so difficult for us to do some activities, even our daily activities. But mental health is just as important as our physical health. For example, we do have healthy body for activities, but if we don't have the desire, the courage, or even enough confidence to do something because of the problems with our mental health, then what's the point? Well, I can say that decreased mental health can also result in decreased physical health, such as major depression, which can make it difficult for people to sleep and even make a person eat irregularly, which resulting in complication from disease of the eyes, brains, and also stomach. So the second one, we have mental illness that can affect anyone. Okay, mental illness no age limit. So this mental illness can affect anyone like children, adolescents, adults, and even the elderly. So mental illness can also affect the richest person in the world, the most beautiful, the most handsome, or even the most popular person in the world. So we could say that this mental illness could suddenly appear for like several reasons. First, it might affect anyone. Therefore, don't underestimate this mental illness. So the third one is the effect extends further in individuals' life. How? The mental illness affects our mind, so our brain performance decreases and our vision turns like, for example, we see an A as a B and vice versa. Mental illness also affects our feelings, so it could like easily get angry for even small things or feel nothing even though we used to really like those things. So last, mental illness can also affect our daily behavior. With a combination of irrational thoughts and our chaotic feelings, our behavior is bound to change as well. So next, types of mental illness. Well, actually, there are so many types of mental illness, but because I don't have much time, I'll just summarize all of that into 10 main types of mental illness. So the first one is anxiety disorder. Okay, anxiety disorder is a group of mental health disorders that include generalized anxiety disorders, social phobia, specific phobia, like for example, agoraphobia, panic disorders, obsessive compulsive disorder, or you can call it OCD, and post-traumatic stress disorder. Untreated anxiety disorders can lead to significant impairment on people's daily lives. So the second type is behavioral and emotion disorders. So mostly it occurs in children. Okay, so common behavior and emotional disorder include oppositional defiant disorder, or you can call it ODD, conduct disorder or CD, and attention deficit hyperactivity disorder or ADHD. So treatment for this mental illness, for this mental health disorder can include therapy, education, and also medication. Okay. So the third one, we have bipolar affective disorder. So bipolar affective disorder is a type of mood disorder which previously referred as the manic disorder. So a person with bipolar disorder experiences episodes of elations and depression. The person may or may not experience psychotic symptoms. Well, I'm going to discuss about psychotic later. So the exact cause of this mental illness is unknown, but a genetic predisposition has been clearly established. So environment stressor can also trigger episodes of this mental illness. Okay, so the first one, we have dissociation and dissociative disorder. So dissociation is a mental process where a person disconnects from their thoughts, feelings, memories, or sense of identity. While dissociative disorders include dissociative amnesia, dissociative views, depersonalization disorders, and dissociative identity disorder. Next, we have eating disorders. So, eating disorder include anorexia, bulimia nervosa, and other binge eating disorders. Eating disorders can affect females and also males and can have serious psychological and physical consequences. So it won't only affect your mental, it will also affect your physical health. Okay, and the next one, we have paranoia. Paranoia is the irrational and persistent feelings that people are out to get you. Paranoia may be a symptom of conditions including paranoid personality disorder, delusional disorder, and schizophrenia. So, treatment for this paranoia include medication and also psychological support. Okay, so next we have post-traumatic stress disorder. Okay, let's just call it PTSD. So, PTSD is a mental health condition that can develop as a response to people who have experienced any traumatic event. This can be a car or other serious accidents. Also, the physical assault, sexual assault, war-related events or torture or natural disasters such as bushfires or floods. Next, we have depression. Okay, so depression is a mood disorder that characterized by a lowering of mood, loss of interest and enjoyment, and also reduced energy. It's not just feeling sad. And I'm gonna tell you that there are different types and symptoms of depression. There are varying level of severity and symptoms related to depression. So symptoms of depression can also lead to increased risk of suicidal thoughts or behavior. So we move to the next one. Next we have psychosis. Okay, so people that are affected by psychosis can experience delusions, hallucination, and confused thinking. Psychosis can occur in a number of mental illness, including drug-induced psychosis, schizophrenia, and mood disorder. Medication and psychological support can relieve or even eliminate psychotic symptoms. Okay, so next we have schizophrenia. So schizophrenia is a complex psychotic disorder that characterized by disruptions of thinking and emotions, and also a distorted perception of reality. Symptoms of schizophrenia vary widely, but may include hallucinations, delusions, thought disorders, social withdrawal, lack of motivation, and impaired thinking and memory. So people with schizophrenia have a high risk of suicide. And schizophrenia, I'm gonna tell you that it's not a split personality. Okay, so just gonna move to the next. Causes of mental illness. Okay, so the first one, we have childhood abuse, trauma, or neglect. So the trauma of a person from their childhood cannot be underestimated, especially the trauma from the violence or child abuse, because it's just so difficult for children to solve their own psychological problem due to the trauma. So I guess that it will be embedded in their minds until they become an adult. Next, we have social isolation or loneliness. So loneliness can certainly make you stressed and depressed because without the support from the people out there, your mind becomes so narrow and you'll find it difficult to make peace with yourself. 3. Experiencing discrimination and stigma. Okay, so stigma is when someone sees you in a negative way because of your background, your character, and your physique. While discrimination is when someone treats you in a negative way because of your background, your character, or your physique. So I must say that social stigma and discrimination can make your mental health problems even worse. And in some cases, it could even stop a person from getting the help they need. Or social disadvantage, poverty, or debt. So it was pretty obvious, right? One of the highest rates of mental health problems are associated with poverty and socio-economic disadvantage. Okay, simply put, you need money to live, right? But but you're short of money, and it's just so difficult for you to live a decent life. So you just become stressed because of it. Okay, and the fifth one we have bereavement. So bereavement is like losing someone close to you or someone you love. It's not easy to forget memories with the people who plays an important role in your life. And the moment when you realize that those memories won't be repeated again because that person has gone, I can say that's where your stress hits. Okay, next we have drugs and alcohol misuse. So chronic use of some drugs and alcohol can lead to both short and long-term changes in the brain, which can lead to mental health issues including paranoia, depression, anxiety, aggression, hallucination, and other problems. Well, many people who are addicted to drugs and alcohol are also diagnosed with other mental health disorder and vice versa. So, I guess that compared with the general population, people that are addicted to drugs and alcohol are roughly twice as likely to suffer from mood and anxiety disorder. So, seventh, the significant trauma as an adult, such as military combat, being involved in a serious incident in which you fear for your life, being harassed, or being the victim of a violent crime. It can also make you trauma. Okay? And last, we have physical causes. Okay, so for example, a head injury or a neurological condition such as epilepsy that can have an impact on your behavior and mood. Well, I want to tell you that it's important to rule out potential physical cause before seeking for treatment for a mental health problem. Okay, so actually, there is still one more cause of the mental illness, namely genetic. I didn't put it here because, okay, first, it's true that if a person has a mental illness, there's also a possibility that his parents have also had the same mental illness, so that this mental illness can also pass to their children, their biological children. You can say that there's almost a 15% chance that mental illness is hereditary. But if we seek further, why did the parents even have the mental illness? Well, that's what I want to discuss about today. If it's only be focused on hereditary or genetics, people will just tend to surrender to their fates as, yeah, I was born to parents with mental illness, so isn't it normal if I also have the same mental illness? Well, I'm gonna say that it's not quite true because there are more causes for mental illness, such as trauma or being a victim of a violent crime, social isolation, or loneliness, and many more. So I'm gonna say that whatever the cause, don't just give into the situation because there's still a solution for every mental illness. Okay, so we'll move to the next section. So next, I will discuss about the symptoms of the mental illness. What are the symptoms? Okay. First, we have excessive worrying or fear. Well, worrying or fear is like feeling uneasy, and it was a condition when we are being overly concerned about a situation and problem. With excessive worrying or fear, our mind and body go into overdrive as we constantly focus on what might happen. And in the midst of excessive worrying or fear, we might be suffer from a high anxiety or even panic during waking hours. So I'm gonna give you an example. So this is Bob. He is coming down the stairs and is going to prepare himself to go to the office because today he has a really important meeting. What is this strange feelings? Did I forget to lock the windows? What if a thief gets into the house? Is there a snake in my house? Or maybe there's a problem with the gas cylinder and electricity in my house. Oh no, seems like I have to cancel all the meetings today and just stay at home. So that was an example for the excessive worrying over. Okay, next we have the extreme mood change or mood swings. So the extreme mood change or mood swing phenomenon is a common concept used to describe rapidly and instantly fluctuating emotions. People often describe mood swings as a roller coaster of feeling from happiness and contentment to anger, irritability, and even depression. So here's an example. Well, there's a couple who just came back from a journey, and it looks like they didn't stay overnight or having a long journey because they didn't brought back suitcases at all. So this is their little conversation between a normal boy and a girl with these symptoms. I'm so happy today. You do? Yeah, this day couldn't be any better. I met my old friends, bought branded stuffs, went to my favorite places, etc. Eh, I forgot to go to the living mall. It's okay. We can go there again next time. No, there's no next time. Why did you remind me to go there? Well, I'm sorry, but it's so late already. You're so selfish. Go away. I hate you. This is the worst day ever. Okay, what a moody girlfriends, right? Okay, so, okay. The next one, we have feeling excessively sad or low. So this is a condition where you tend to feel sad or down for no particular reasons. And moreover, the feelings of sadness that you're experiencing are stronger than usual. And of course, it can make you feel stressed, emotional, and even lose your interest in life. So here's an example. So there are two people who have made an appointment at the house of one of them. They were close friends who had been separated by great distance. But even though they were not seeing each other for a really long time, the yellow guy's face looks so uneasy. Oh, okay, let us say that they have eyes, nose, and the lips, okay? So, hi, welcome. Long time no see. Hi, your little baby looks so cute. Thanks. You just turned 1 year old last week. You're so lucky. Always I hate your life. Hey, stop it, dude. Anyway, I heard that you were on a blind date. So, how's it going? You left me. My life's a trust. Nobody loves me. I wish I can at least die peacefully. Hey, dude, stop it. You must be grateful for what you have. I'm so useless. You won't understand because your life has been full of joy. Here we go again. Okay, that was just so funny but so sad at the same time. Okay, so let's just move to the next sentence. Okay, there we have confused thinking and problems concentrating and learning. So concentration difficulties can be caused by medical, cognitive, or psychological problems, or may be related to sleep disorders, medication, alcohol, or drugs. Learning difficulties constitutes condition which create an obstacle to a specific form of learning. So here's an example. 2 plus 2 equals 4. How is that even possible? Shouldn't the answer be 22? Okay, what a logic. I don't get it. Okay, let's just move to the next. Next, we have avoiding friends and several activities. Okay, so people with avoidant personality disorder have chronic feelings of inadequacy and are highly sensitive to being negatively judged by others, though they would like to interact with others. But instead, they tend to avoid social interaction due to the instincts of fear of being rejected by the others. Okay, so here's an example. All students have submitted their approval for school camp events. So how about you? I'll pass this time, teacher. Hey, bro, let's go to the library after school. Oh no, I'm okay. I can study by myself. Why? We can also go to the newly opened cafe next to the library. No, thanks. Seriously? What's wrong with him? So I guess that he changed a lot, okay? And the next one we have change in eating habits. So this is condition when you're under or overeating. not having enough of the healthy food you need each day, and or consuming too many types of food and drink, which are low in fiber and high in fat, salt, and sugar. So there was a girl in a class who was suddenly visited by her younger brother in class. Well, it seems like she didn't bring something that she should have brought to school. So excuse me, sis, you forgot to bring your lunch box. Now, I'm not going to eat lunch today. But you haven't eaten anything since morning. At least eat this bread. You can spare the rice. No, I'm just not feeling like eating anything. No. The doctor has warned you to eat regularly. If not, it could have a negative impact on your health. Don't talk as if I'm committing suicide attempts, okay? Just go home. Whatever. So I can say that the symptoms is actually different from diet. It is a problem with a person's appetite, which suddenly rise or falls drastically. So next. Okay, so manufacturers can cause or contribute to irritability or anger, including your life stress, lack of sleep, or low blood sugar levels, and also hormonal changes. Extreme irritability, such as feeling irritable during extended periods, can sometimes indicate an underlying conditions. For example, an infection or diabetes. So, okay, there came a mother and the son who came to the park to rest for a while. Mom, can I play by the fountain? No, it's dangerous. But Mom, why is it dangerous? Don't ask me, just sit back and don't chase me. But Mom, I'm so bored. You're so noisy. Can you stop your mouth? Or do you want me to stitch your mouth? Huh, look at you. So now you're there to talk back to me, huh? I shouldn't have taken you to the park. Let's just go home. But Mom, we just arrived. I promise I won't ask anything again. I'm sorry, Mom, but please shut up. Okay, what a hot-tempered mom. In fact, I'm gonna say that this is so natural. It's common for children in their developmental years to have high curiosity and thought love. However, the mother actions were wrong. She shouldn't have treated her son like that. Because of her, I can say that because of her, her son could have the mental illness at the young age. If we as parents often set an example that is not good for our children, then don't blame our children if they grow up just like us. Next. Okay, so it's occurs when a person uses alcohol, prescription medicine, and also illegal substance in the wrong way. Substance abuse is different from addiction. Okay, many people with substance abuse problems are able to quit or can change their unhealthy behavior. But addiction, on the other hand, is a disease. So here's an example. In the middle of the day, in a public place, there are two drunks and drug users going crazy in the middle of the park. Then came two normal girls who felt strange with the behavior of two drunk people. Hey, what's wrong with them? In the middle of the day, in a public place? Huh, seriously? I didn't know they're crazy, but it looks like they're under the influence of alcohol or drugs, I guess. So sad, but just too sad. That's why I don't want to find a boyfriend who drinks alcohol. So, okay. So next, change in sleep habits, feeling tired and low energy. So it can also be a symptom of mental illness due to the difficulty of the brain coordinating with the sensory system led to difficulty sleeping. And it can also caused by overthinking and uneasy thoughts, making it difficult to sleep or make us tired due to the lack of energy. So here's an example. So as we can see, there is someone sleeping on a park bench and someone is jogging in a park that passes by and stops for a moment. Hey, Brandon? Anthony? Huh, why are we just sleep here? Did you have a home or something? It looks like I overslept. I'm sorry. I didn't know why. Lately, I'm just so tired and sleepy all the time. Are you sure that you're okay? You also often fall asleep in class and nearly pass out during exercise hours. Yeah, I'm fine. It's just that lately I sleep later than usual. Go fix your bad habits and try to exercise more often. Thanks. Okay, I'll take your advice. Okay, so I'm gonna say that due to the lack of awareness, excessive fatigue, it can also affect the ability of our mind to absorb other people's words and stammer in speaking like huh, and anything like that. So let's just move on. Diagnosis and treatment. So first, we have the diagnosis. So to determine a diagnosis and check for related complication, the doctor or your mental health problems may ask you to have first a physical examination. So your doctor will try to rule out your physical problems that could cause your symptoms. Next, lab tests. These may include, for example, a check of your thyroid function or screening for alcohol and drugs. Next, a psychological evaluation. So a doctor or a mental health professional talks to you about your symptoms, thoughts, feelings, and your behavior patterns. You may be asked to fill out a questionnaire to help answer these questions. So next we have the treatment. So the first one is medications. Although psychiatric medication don't cure mental illness, they can often significantly improve the symptoms. Psychiatric medication can also help make other treatments such as psychotherapy to be more effective. The best medication for you will depend on your particular situation and how your body responds to the medication. So next we have psychotherapy. Okay, psychotherapy, also called as a talk therapy. It involves talking about your conditions, related issues with a mental health professional. So during psychotherapy, you'll learn about your condition and your moods, feelings, thoughts, and behaviors. Okay, with the insight and knowledge you gain, you can learn coping and stress management skills. Next, we have brain stimulation treatment. Okay, so brain stimulation treatment are sometimes used for depression and other mental health disorder. They're generally reserved for situations in which medication and psychotherapy haven't worked. They include erectose, pulsive therapy, repetitive transcranial magnetic stimulations, deep brain stimulation, and also vagus nerve stimulation. So make sure you understand all the risks and benefits of any recommended treatment like this medication, psychotherapy, or anything like that. Next, hospital residential treatment programs. So sometimes mental illness becomes so severe that you need care in a psychiatric. This is generally recommended when you can't care for yourself properly or when you're in immediate danger of harming yourself or someone else. So options include 24-hour inpatient care, partial or day hospitalization, or residential treatment, which offers a temporary supportive place to live. Another option may be intensive outpatient treatment. Okay, next one, we have substance misuse treatment. So a problem with substance use commonly occurs along with mental illness. Often, it interferes with the treatment and worsens the mental illness. If you can't stop using drugs or alcohol on your own, you're gonna need treatment. So talk to your doctor about your treatment options. And last, we have participating in your own care. So like working together, you and your primary care provider or mental health professional can decide which treatment may be best depending on your symptoms and their severity. Your personal preference, medication side effects, and other factors can help as well. In some cases, a mental illness may be so severe that a doctor or your loved one may need to guide your care until you're well enough to participating in your decision making. So, next. 10 things you can do for your mental health. Okay, the first one, value yourself. So treat yourself with kindness and respect, and also avoid self-criticism. Make time for your hobbies and favorite projects, or maybe you could broaden your horizons. Like do a daily crossword puzzle, plant a garden, take dance lesson, learn playing instrument, or maybe you become fluent in another language. Two, take care of your body. Taking care of yourself physically can also improve your mental health. So be sure to eat nutritious meals, drink plenty of water, get enough sleep, avoid smoking and vaping, and also do some exercise. Three, surround yourself with good people. Okay, so people with strong family or social connection are generally healthier than those who lack a social network. So make plans for your support family members and friends, or seek out activities where you can meet new people, such as club, class, or support group. Four, give yourself achievement. So I can say that you must volunteer your time and energy to help someone else out there. You'll feel good about doing something tangible to help someone in need. And also, it is a great way to meet new people. I would have told you in the previous point that you have to increase your social connection to reduce your stress level. Okay, so next, learn how to deal with stress. Okay, like it or not, stress is a part of our life, not only mine, but also yours. So I'm begging all of you to practice good coping skill, like try many stress strategies, do tai chi, exercise, take a natural walk, play with your kid, or maybe you could like try journal writing as a stress reducer. And also remember to smile and see humor in life. Because stress is so that laughter can boost your immune system, ease pain, relax your body, and also reduce your stress. Next, quiet your mind. Like try meditating, mindfulness, and or prayer. Because relaxation exercises and prayer can improve your state of mind and outlook in life. In fact, research shows that meditation may help you feel calm and enhance the effects of therapy. So whenever you have a therapy or treatment, maybe just try to meditate, okay? So, seven, set realistic goals. So this is what you want to achieve academically, professionally, and personally. And also write down all the steps you need to realize your goal. Remember, aim high, but be realistic and don't overschedule. You'll enter a tremendous sense of accomplishment and self-worth that you progress towards your goal. Next, break up the monotony. So I must say that although our routines make us more efficient and enhance our feelings of security and safety, a little change of pace can crack up a tedious schedule. So maybe you collect older jogging route, plan on a road trip, take a walk in a different park and see new pictures around the wall, or maybe you could like try a new restaurant. Next, avoid alcohol and other drugs. So keep alcohol use to a minimum and avoid other drugs. Sometimes people use alcohol and other drugs to self-medicate, but in reality, alcohol and other drugs only aggravate the problems. So better be safe than sorry. Last, get help when you need it. Well, I must say that seeking help is a sign of strength, not a weakness. And it's important to remember that treatment is effective. So people who get appropriate care can recover from mental illness and addiction and live full, rewarding lives. So that's all. And so today I'm gonna give a video about 10-minute meditation to reduce your anxiety, stress, and also fear.
Hey there, I'm John. Welcome to this meditation to help you reduce stress. Before we do anything else, I'm going to ask you to pause wherever you are at this moment and take notice of how you're feeling. Try watching and listening carefully and curiously to what's going on inside you right now. Now take a deep breath, focusing your attention completely on the inhale and the exhale of that breath. Now take a deeper breath. And this time, send the oxygen into your body, and give it permission to still and relax. And with your third breath, the deepest one yet, repeat to yourself silently, I am here. Now, how do you feel? Taking just 3 intentional breaths can help you shift into a calmer energy state. It's a quick and easy way to help alleviate stress, and a great gift of care you can give to yourself. Now, from this space that's more still and more calm, gently close your eyes if you haven't already, allowing your body to settle into a position you can hold comfortably. Begin again to take slower, deeper breaths, allowing your breathing to ground you and still you even further. Giving yourself permission right now to focus on you, making yourself your first priority. Your well-being and self-care are your focus. Continue to take slow, deep breaths, allowing each inhale to be a bit deeper than the one before it. Feeling your lungs expand out as you inhale, holding it for a beat, and contracting everything back in as you exhale. As you continue to breathe this way, feel the journey of the breath through your body, and notice any places where you may be holding stress. Unfurrow your brow, unclench your jaw, let your shoulders drop down from your ears, and open your palms. And now allow your breath to return to its normal rhythm and pattern, but keep your focus on it and allow it to be your anchor during this meditation. If you get distracted by a thought or a sound, simply acknowledge that it occurred, and then gently let it go, and return your attention to your breath. When we are stressed, our perception of a situation isn't as clear as it could be. Our heightened emotional state tends to include not only the stress, but our judgments about it. And these judgments, along with stories we may be telling ourselves about the situation, bias our view and cause us even more stress. So right now, I invite you to call to mind a situation that you feel brings you stress. Watch it, if you can, from a place of curiosity, as if you were simply gathering information. Ask yourself, how true is my perception of this situation? Am I holding old judgments or stories about it that are clouding my view? As you notice these judgments or stories, acknowledge them as having served you in the past, and now give them permission to drop away. You don't need them anymore. Let them go. Now, without those judgments or stories, does the situation look or feel any different to you? From this clearer perspective, we can begin to see how our own judgments and resistance to the situation can cause them to appear more severe than they actually are. Which brings us to the next step in this process: acceptance. Accepting a situation is acknowledging that it is happening, not necessarily that we agree with it or approve of it. Our very resistance to a situation brings us stress. Without the resistance, we see the situation more clearly, and then also we're open to see potential new solutions we hadn't before. See if you can begin to allow yourself to acknowledge and accept that the situation is happening, knowing that in this moment you are safe and you are okay. Continue breathing with your eyes closed. Just let your attention start to focus back on my voice. When we're stressed, we aren't able to see a situation clearly. By giving ourselves the gift of pausing and reflection, even if only for a few deep breaths, we allow ourselves to see the situation more clearly. From this safer, more still space, we can ease our resistance to it, which in turn eases the stress. Now let's take 3 more deep breaths together. Take a deep inhale in, holding it for a beat, and exhale it out. Again, an even deeper breath than the one before it, feeling it weave in and out of your muscles and cells. And exhale it out. Last time, your deepest breath yet. Sending that oxygen through your entire body, all the way down to the tips of your toes. And when it reaches the top of your head and you're ready, you can open your eyes. Thanks for joining me for this meditation. Be well.
This YouTube channel is Bright Side with 40.3 million subscribers, and by the title of A Japanese Method to Relax in 5 Minutes. Okay, let's just move to conclusion. Okay, so mental illness is a grand general term for a group of mental illness that may impact on a person's thoughts, perceptions, feelings, and behaviors. Mental illness can affect your working and also your personal relationships. Medication, counseling, or both can help you to manage your mental illness. So, to avoid mental illness, I'm begging all of you to often spend your time with positive activities like working out, like helping anybody, and with positive people. Okay, so that's all for me, and thank you so much for joining our webinar event today. So,
Wow, wow, what a great presentation from Cecilia. Now I think I should really be aware of my mental health, not only my physical health. So now we're gonna have a Q&A session. You can raise your hand or just type in your questions in the chat column. 2 questions maximum. I'm going to open the quick Q&A session now. You can ask in the chat column or you can just raise your hands. Are there any questions? If there are no questions, then I'll ask a question myself to Cecilia. All right, so Cecilia, are you ready for my question? Oh, there is, okay. From Miss Diana, all right. As a student, what should you do if your friend has a mental health problem?
okay, so I've never experienced any mental illness, and I hope that I wouldn't have to. So I don't know how it feels, or I don't know what it's like to be in her position. But one thing I know that my friends going through terrible times. Well, I'm not a doctor, so I'm not sure that I can cure the mental illness, but I can just let her suffer like that either. So I'll try my best to always be by her side and be a good listener for her. Sometimes I do believe that when a person is depressed, what they want most is a listener that who can calm them down in any situations. So she may scream out of control or cry until she runs out of tears, but I'll just act like it's normal so that she won't feel embarrassed or uncomfortable around me. Well, people say distraction is an effective way to make someone forget that she is going through a bad situation. So I may even ask her to do like some interesting things like play games, do some hobby, go to the amusement park, plan on a trips, or like having dinner together. And also, I don't think that I hope that there are still so many wonderful things in the world, and she knows that. She knows that so many people love her, care about her, and prioritize her, including me. And it was just too sad if she only focused on those healthy thoughts and feelings. So I'll make her knows about that. I'll also make her feel special, precious, and also worthy of love. And actually, I will try my best to pull her back on the right path. But if her conditions get too bad, and I can't help it, just guess she have to go to the psychiatrist because if a mental illness is present continuously and didn't getting any better, it means that its effects are getting worse day by day. But if this situation worsens, it needs a professional and intensive care to cure it. But nevertheless, the choice rests with her. I, as her friends, could only I couldn't force her with to live like what, to live like this or to live like that, or to go on a psychiatrist. I can only motivate her and wish her all the best. So that was my answer.
So, Miss Diana, are you satisfied with the answer from Cecilia?
I'm sorry.
Miss, are you satisfied with the answer from Cecilia? All right, we're just gonna move on. Is there anyone who wants to ask the second question? Okay, thanks. All right, thank you, Miss. Is there anybody else who wants to ask another question? No one? Okay, can I ask you a question, Cecilia?
Yeah.
So how does a friend affect your mental health? Do, does friends really affect your mental health, or it just doesn't give any effect at all, or does it give a huge effect to you?
Well, okay. I must say that friendship are unique because they're tied to so many aspects of our life, like our family, works, and also our hobbies. So, with a good friendship, we gain so many benefits, such as increased feelings of belonging, purpose, increased level of happiness, reduced level of stress, improved self-worth and confidence. While a toxic friendship can leave you feeling drained, stable, unsatisfied, and often unable. So I must say that humans by nature are social animals. Our friendship can have a tremendous impact on our lives, which is why it's important to make sure that they're leaving you feeling supported, understood, and happy. So that was the answer.
Okay, I'm quite satisfied and I understood your answer. Thanks, Cecilia. So, because there are two questions already, I'm gonna close the Q&A session. So before I hand this presentation to the host, remember to fill in attendance the attendance link which is sent by Pak Satria, Sir Satria just now in the chat column. You can fill that in right now. Remember to fill it in because it's some proof that you guys have came into our webinar. So now I'm just gonna give this to the host.
Okay, thank you to the moderator who has fostered this webinar so well. And thanks also to the presenter who has presented a very interesting and useful material. So I do agree that mental health is just as important as physical health. In fact, if our mental health decreases, it will affect our daily behavior. So, hence we bring up this topic to raise awareness of the mental health of all of us. So, before I actually end this webinar, I want to remind you to fill in the attendance link in the chat. I will wait another minute for all of us to turn on camera and take a photo together. Okay, we don't have much time left. Please turn on camera and we will take a photo together. Just for a while. Alright, if there is anybody cannot turn on camera, that is fine. Okay. 1, 2, 3, cheers! Okay. Okay. Thank you for joining us today in our webinar. Have a nice day. See you.